about the lack of a top commander, command like a administrative position for the health sector in Sri Lanka, both government and the private sector. Similar to the when we look at the Attorney General Department, Attorney General, actually who heads the the government legal advisory branch, and the Solicitor General, and also the when we look at the Chief Justice who heads the judiciary. Similarly, I think there's a need for someone to be at the head as the administrative person for the health sector. So for the both the private sector and the public sector, because the current Ministry of Health Secretary, or the or even the Minister of Health, or the specific subject State Minister for COVID-19, or even the Health Ministry Director General, I think these positions are not really more like accountable and responsible to the post like Chief Justice or Attorney General or Solicitor General Department. They are more specifically accountable for their workforces below. So similar position is needed for Sri Lanka health sector. I think in that case the director, I think the Surgeon General, or General, I think Surgeon General of Sri Lanka would be the appropriate name for such a position. So I was actually discussing about the previous video about this incident at the Sri Lanka Army Staff and College Command College during my lecture about I think it was between 2003 or 2002, that period. So when I did my lecture, I pointed out at that time the government was under Mr. Ranil Wickremesinghe from United National Party, and accordingly there was Minister of Defence, and the President was Mrs. Chandrika Bandaranaike, who is the Commander-in-Chief according to the constitutional law of Sri Lanka, and from another People's Alliance political party. So two different authority commands when it comes to the military, army, navy, air force, and STF under police, and even the police had two different commands. It could be practically, sometimes there can be different commands coming from these two commands. So I highlighted this during my lecture at the Army Staff and Command College in Batalanga, and I mentioned the names, the political leaders' names, and also said, see, this type of two command structure, because according to Henry Fayol's management theorist principles, administrative principles on management, the command must be one. That's why I propose one command for the Sri Lanka's public and the private health sector. So according to the Henry Fayol's administrative principles, if there are the command, there must be unity of command. The command must be coming only from one. That means only one person can give orders to a subordinate below. So based on this principle, I was discussing about it, and once I mentioned the political leaders' names, there was like a somebody in the audience, I think someone who was looking at my this lecture at that time, said that I cannot mention the names of the politicians during the lecture at the Army Staff and Command College in Batalanga. Then I said, of course, I am a teacher. This is not a political meeting. I came here to teach voluntarily without any payment. So therefore, I cannot, I have to mention this, since this can be a problem if Army has Sri Lanka military has two commands like this. But then he said, the particular person who was there, he was not a student, but he was someone who was just looking into my lecture. So then he said, if you withdraw the names of these two political people, you can carry on. If not, you can stop. Then I said, of course, I will stop them, because my purpose is to teach here, not to drag on a political issue here. But without naming the parties in the real situation, I cannot teach here. So I accordingly stopped the lecture, and I had to come out. So actually, what I taught was correct, because if I was not disturbed that day, Because practically what happened was, even during the present United Nations Human Rights Commission's main allegation is the accountability and responsibility with regard to the final stages of the war. Because final stages of the war, where was the unity of command? From where the commands came is the question that they ask even today. So if I was allowed to explain at that time, this problem could have been avoided. Now this is the consequences of avoiding and trying to stop someone who truthfully try to teach. At that point, if I was allowed to teach this principle, this problem could have been avoided today. Because with regard to the final stages of the war, the main dispute is as to who holds the final accountability. Nobody is accountable finally for what happened during the final stages of the war. That is why I think when we have to respect the teachers. If not, this is what can happen. So that is why I'm recommending now, of course, in the present context, to have a Surgeon General of Sri Lanka, as it reflects the principles of administrative and management by Henry Fayol, a management and administrative theorist, as to the unity of command in any organizational matter must be only from one person. As such, Sri Lanka must have a Surgeon General of Sri Lanka to head the government health sector and also the private health sector in Sri Lanka.